project really provided us with this opportunity. So when I first approached Captain William Walsh, or he approached me about it, it really came as a sort of idea together that both of us sort of started thinking about the data. How can we improve it? How can we assist the program that is already in place and make it better, right? And so I think at the end of the day, we know from the literature's multi-agency peer support programs, or peer support programs generally, are incredibly positive, useful in creating a better atmosphere, better culture. But we know very little about what, right? What are the particular factors? What are those variables that are really creating this change, this positive change in not only police culture, reducing stigma, improving levels of stress, right? Reducing levels of stress among police officers. And so those are the kinds of questions that we really sort of started talking about, how we might better able to identify this, and then what type of implications this might have itself. Through these conversations, again, through NIJ Leads, really, it's such a unique feature is that, he came in already wanting to do the research, and we happened to be having our conversation at the time. And so one of the things we started talking about is just sort of getting a basic level knowledge, right? Let's get a clear understanding about what types of activities and interventions officers are engaging in. Captain Walsh was already well aware of the training because he himself had developed sort of the training and the guidebook behind developing this program. We knew about some of the players. In other words, we knew about who the peer support program participants were, the peer supporters were, as well as the leaders. But we really weren't quite sure how it was being utilized. And so that sort of information started being collected through the peer support reports. As we started examining them over time, we started changing some of the survey questions, realizing, you know what, officers really seem to be talking to fellow officers more about this topic, right? And perhaps we need to break it down a little bit more to learn exactly what about grief, for example, is it what they're talking about? Are they talking about grief due to the loss of a family member, the loss of a friend, the loss of a fellow officer? And those are really the types of questions we sort of started to ask and investigate a little bit further together. And of course, along with the Dr. John Kelly, who is a police psychologist, who we have been working with for a while. Through this, we've, of course, started examining what are other ways in which we can evaluate this and started looking more towards the future, right? So one of the things that we write in the article is talking about what is the baseline knowledge we have as a result of the peer support programs through the survey we started collecting over the last 2 years. One of the things we started sort of jumping off from this data, now from this information that we now have, is how much we might better be able to understand what exactly that is they are doing. And so we decided to, of course, start off on a qualitative study, right? How do we talk about some of the things? How can we ask some of the questions that we really need to ask the officers to get a better understanding about what are some of those activities and interventions that really they find most useful to their fellow officers and might help reduce some of the stigma, improve their health overall. Yeah, of course. So one of the takeaways from the study that we did based on the peer support reports that we were collecting is that there really is a small number of officers who are engaging in this type of activity. So although you might have, for example, 20 peer supporters, it is very clear that individuals are going to that one person. And not only are they going to that one person, but they're going to that one person over and over and over about a variety of problems that perhaps might overlap. They might be uniquely situated in the context of something that had happened in their agency at their home. We started realizing that in order to develop a better understanding about those situations, it would be great to talk to some of the officers. And so two things came out of this is one of the conversations we started having with the officers is one, let's make sure you're reporting on all the information you're engaging in, because we started identifying some gaps, right? Officers would talk to a person 10 times, they would report on it once. And so it was key for us to sort of make it very clear that it is important to actually gather the information on how many different times they were actually speaking to one individual officer to sort of highlight the importance of the programs, make sure that we were getting a clear understanding and a clear grasp of how often the program was actually being utilized. The second thing is, of course, we started looking at the training, right? What are some of the topics that are coming up? So, for example, there was a short time period where grief was coming up in some of the police reports a lot. A lot of officers were reporting experiencing higher levels of grief due to the loss of a pet, the loss of a family member. And so one of the things that came in during the training is they decided to bring in a grief training counselor, somebody who could actually talk to them about how they might talk to a fellow officer to get through their grief, to provide them with the support necessary for grief, and if not, provide additional referrals that might be able to better prove to be more useful for them. And so those are some of the evidence action things that we started seeing come out of some of the quarterly trainings. Of course, during the quarterly trainings, we started reporting to the officers exactly what they were reporting to us. So every 3 months, we would go into the agency, talk to all of the peer supporters and say, hey, we noticed an uptick in this type of topic. Why is that? What exactly is going on? What are you seeing on the ground? And that proved to be useful because officers started realizing, wow, these reports are actually being used. Everything we seem to be submitting into the survey reports are actually being utilized. We're providing additional understanding on what type of training we might need. We also included a suggestion box in these surveys asking the officers what else do you think might be useful in training, right? What else do you think might be helpful for you to know as you're sort of going through and acting as a peer supporter role for your fellow officers? And so a lot of the officers have provided some very useful information. For example, one of them said, you know what, I'm noticing a lot of the officers need help in financial advising. They're really stressed out about how to buy a home for the first time. And so those are the types of things we started adopting and sort of putting some action forward and trying to think about what about future trainings that might help us provide them with additional resources so that they can help their fellow officers.